the standard wristband tag, the Florida wristband tag, and the tag without a wristband. The no wristband tag use remains the same with the exception of the use of the wristband. Tag features include contaminated evidence strip, personal property receipt, ambulance receipt, the patient wristband, transportation receipt with entries for destination and via, as well as chief complaint. On the back of the receipt, entries for age, first and last name. Personal information entry with entries for age, first and last name, address, phone, and religious preference. Hazmat entry with entries for radiological agent, biological agent, and chemical agent. If a chemical nerve agent is indicated, injector type entries can be found on the back of the tag. Injury indicator with entries for deformities, contusions, abrasions, punctures or penetrations, burns, tenderness, lacerations, and swelling. Vital signs entry with entry for time, blood pressure, pulse, and respiration. Retriage entry. The category receipts. On the back of the tag, treatment entry, with entry fields for known allergies as well as treatment administered and comments. Drug entry with entries for time, drug solution, and dose. And the Start Triage System algorithm with respirations, perfusion, and mental status checkboxes. Using the triage tag. The contaminated strip must be removed if the patient is not contaminated. Remove unused acuity receipts to indicate the acuity level. Remove one bisected receipt that will be utilized for patient accountability in the treatment area. The personal property receipt may be used to associate a patient's belongings to the tag. Complete the patient information entry if time permits. Indicate the treatment provided in the treatment area on the back of the tag. As a patient is being loaded for transport, remove and complete the transportation receipt to ensure accurate patient tracking. The ambulance receipt is provided to the transporting vehicle to ensure proper delivery to the designated destination and inclusion with the service provider's EMS report. The wristband is generally applied when the triage tag is removed at the emergency room or the patient's final destination. All procedures for this tag remain the same with the exception of the use of the wristband. And post-incident documentation. Triage tags are applied to patients as they enter the treatment area after quick secondary triage to confirm or change their acuity category. If treatment areas were not established, the triage tag is applied to the patient just prior to transport. Properly utilized, the DMS triage tag provides patient accountability and tracking through the treatment and transport process. Accountability documentation is an important component of proper MCI/MPI management and post-incident reporting. Patient accountability is achieved in the treatment areas, if established, by removing the outer colored category receipt that matches the patient's triage category. The receipt is placed in an accountability log sheet by the treatment area manager. The unique number on the receipt matches that of the triage tag, allowing the area manager to have a complete record of all patients that entered the treatment area. Proper patient accountability in the ambulance loading area is critical for ensuring accurate bed availability counts and patient tracking. Just prior to a patient being loaded into an ambulance, the transportation receipt located on top of the DMS triage tag is removed by the transportation group supervisor or a designated ICS position given that responsibility. Mandatory fields on the transportation receipt, such as acuity category and destination hospital, must be completed. Optional fields on the back of the transportation receipt are available if time permits or policy requires. Completed transportation receipts are placed in an accountability log for quick reference if needed and for post-incident reporting. Each transportation receipt contains an abbreviated version of the unique barcode number in the right-hand corner. This is the patient's identification number. This number is to be used in all communications when referring to the patient. The simplified format will prevent delays or errors inherent in other numbering systems. The unique 4-digit number can be found on all components of the triage tag for full reference through the treatment, transport, and hospital admissions process. There are several other components of the DMS tags designed to increase efficiencies at scene which should be reviewed during training or multi-company drills.